So hi everyone. Today we're going to see the topic of hand fractures, the most important fracture in the hand injuries and the carpal bones. So what is the bone? Scaphoid bone. It is a fracture of scaphoid fracture. The bone is more commonly fractured during the fall on outstretched hand. Now, why the fracture is so dangerous? Because the unique blood supply. The scaphoid bone has retrograde blood flow. The blood enters from the distal pole, which means in the first grade digital pole and travels towards the proximal pole. So, if the fracture occurs in the waist of scaphoid, the blood supply to the proximal fragment can be cut off. This leads to avascular necrosis. If avascular necrosis develops, the bone collapse, the wrist mechanism are altered, the chronic pain develops, eventually the arthritis also occurs. What is the clinical findings? They always check the anatomical snuff box if the tenderness is present. Even if X-ray is normal, suspect the scaphoid fracture because because the movement and the alignment of the scaphoid is so crucial while the X-ray of the wrist has been shown. The management it is depends on displacement. Non-displaced fracture occurs, thumb spica may be needed. When the displaced fracture occurs, the screw fixation is needed. The early diagnosis is critical to prevent long-term of disability in the wrist. So, coming to the point next, open fractures. Open fracture of the hand or surgical emergency. Why? It is because the infection is risk and extremely high. Hands bones are small, soft tissue coverage is thin, a tendon gliding structure are exposed overly. There are more four management is exploration, accession, evacuation, and external fixation. Accession of deviated tissues, evacuation of contaminants, and external fixation if it is needed or unstable fracture occurs. The broad spectrum antibiotics must be started immediately. The goal is to prevent osteomyelitis and preserve the hand function as soon as possible. The final point of the hand fractures are uh, muscle pull determines deformity. Always identify which muscle is deforming this fracture, and the rotational deformity is more dangerous than angulation deformity because it affects grip and alignment. Intra-articular fracture must be anatomically reduced to prevent post-traumatic arthritis, and early mobilization prevents the hand functions and becomes stiff in very quickly. A stiff hand is worse than a slightly malunited hand. Functions is more priority than any other thing. A scaphoid fracture can develop avascular necrosis due to retrograde blood supply, and tendon avulsion needed a different management than the fractures. Like manual fingers need a splint, and jersey finger need surgeries. Open fractures are surgical emergency. Infection control is the priority for the open fractures. Now always check the tendon function in the hand. Ask the patient to flex and extend each joint separately while the fractures occur. We need to check before them. The goal of the treatment is to functional recovery, not just to radiological perfections. So, if you understand the muscle balance, joint continuity, the vascular supply, and tendon mechanics, you will never confuse the managed hand fractures. The hand is small in size but huge in functions. Protecting the hand function means protecting the independence. Thank you for the classes.